Hello, I'm Dr. Ryan Westbrook, and I'm a cardiac surgeon with over 20 years of experience in the operating room. I've spent 2 decades looking inside people's hearts, fixing problems, and seeing firsthand what happens when things go wrong. Today, I want to talk with you about something that affects millions of people over 60, and it's something most doctors don't discuss openly enough. I'm talking about common medications that are supposed to help your heart, but in certain situations can actually increase your risk of a heart attack. Now, before you panic and stop taking your medications, let me be clear about something. If your doctor prescribed these pills, they had good reasons. But here's the problem. Medicine is not one size fits all. What works beautifully for one person can be problematic for another. And if you're over 60, your body is different than it was at 40. Your metabolism is different. Your kidneys and liver aren't processing things the way they used to. And sometimes, medications that are generally protective can become risky. I see patients come into my office all the time who are taking medications they've been on for years, and they've never had a conversation with their doctor about whether those medications are still right for them. They just keep taking them because that's what they've always done. And sometimes that's a dangerous assumption. Let me walk you through 5 categories of medications that, in certain patients over 60, need very careful monitoring. And I want to be specific about who needs to worry most. The first category I want to discuss is non-steroidal anti-inflammatory drugs, or NSAIDs. Now, you might be thinking, wait, NSAIDs? I thought those were heart protective. And you're right, partially. Here's the thing that most people don't understand. NSAIDs like ibuprofen and naproxen can be helpful for inflammation, but they increase your risk of blood clots, and they can raise your blood pressure. For someone over 60, especially someone who already has risk factors, regular NSAID use significantly increases heart attack risk. Why? Because NSAIDs interfere with the blood vessel's ability to regulate properly. They can cause the endothelium, that's the inner lining of your blood vessels, to become dysfunctional. They increase inflammation in the arteries themselves, and they can make your blood stickier, more prone to clotting. I've had patients in my cardiac unit who took daily ibuprofen for arthritis, thinking it was a safe choice, and then they had a heart attack at 65. When we investigated, the NSAID use was a significant contributing factor. If you're over 60 and you're taking NSAIDs regularly, you need a conversation with your cardiologist. This doesn't mean you can't take them at all. It means you need to be strategic. Use them at the lowest dose for the shortest time possible, and consider alternatives like physical therapy, acupuncture, or targeted exercise. The second category is certain blood pressure medications called alpha blockers. Now, alpha blockers do lower blood pressure, and lower blood pressure is generally good for your heart, right? Wrong. It's more complicated than that. These medications, things like doxazosin, can cause a sudden drop in blood pressure when you stand up. For someone over 60, this sudden drop can cause dizziness, falls, and potentially a heart attack because your heart has to suddenly work much harder to compensate. But there's more. Alpha blockers can also trigger reflex tachycardia. That's a sudden increase in heart rate to compensate for the blood pressure drop. And that rapid heart rate, over time, can stress the heart. It can trigger arrhythmias, and it increases your oxygen demand. For someone with coronary artery disease, that increased demand can mean the difference between stable angina and a full heart attack. I'm not saying don't take alpha blockers if your doctor prescribed them. But if you're over 60, you should be on a different class of blood pressure medication first. Alpha blockers should usually be a second or third line option, and if you are taking them, you need regular cardiac monitoring. The third category is decongestants, and this surprises people. Decongestants like pseudoephedrine, the active ingredient in many cold medicines and sinus medications, they narrow your blood vessels. That's how they reduce swelling in your sinuses. But that same blood vessel narrowing happens throughout your body, including in your coronary arteries. For someone over 60 with any degree of coronary artery disease, even mild disease, that vasoconstriction can reduce blood flow to your heart muscle. And reduced blood flow to heart muscle means reduced oxygen. And lack of oxygen to the heart is how heart attacks happen. During cold and flu season, I see patients come in with chest pain after taking over-the-counter decongestants. They think it's just a cold, but actually, the medication is causing coronary vasoconstriction. It's a real problem, and it's easily preventable by just avoiding these medications if you're over 60. The fourth category is stimulant medications. Now, I'm talking about prescription stimulants, sometimes prescribed for ADHD, as well as over-the-counter stimulants like excessive caffeine and certain weight loss supplements. These medications increase heart rate and blood pressure. That might not sound like a big deal, but for someone over 60, it is. Your heart's electrical system becomes more sensitive with age. Stimulants can trigger arrhythmias. I've seen patients, otherwise healthy, go into atrial fibrillation after starting stimulant medications. And atrial fibrillation is a serious condition that significantly increases your stroke risk. But more than that, the constant elevation in heart rate and blood pressure caused by stimulants puts chronic stress on your heart. If you're over 60 and you're considering stimulant medication for ADHD or weight loss, you need a cardiac workup first. You need an EKG, you need an echocardiogram, and you need honest conversations about whether the benefits outweigh the risks. The fifth category, and this is important, is certain antihistamines. Specifically, older antihistamines like diphenhydramine, which is in Benadryl. These medications have anticholinergic effects. That means they block acetylcholine in your system, and acetylcholine is important for normal heart rhythm regulation. Anticholinergic medications can increase your heart rate and can trigger arrhythmias. They can also increase your blood pressure. For someone over 60, especially someone with any cardiac history, antihistamines like diphenhydramine can be genuinely dangerous. There are newer antihistamines like cetirizine and loratadine that don't have these anticholinergic effects. If you're over 60, that's what you should be taking. Now let me talk about what happens after 60 that makes these medications riskier. First, your cardiac reserve decreases. This is huge. Cardiac reserve is your heart's ability to increase its output when stressed. A 20-year-old's heart can increase its output 5, 6, even 7 times during exercise or stress. A 60-year-old's heart might only double its output. Your heart can't compensate the way it used to. Second, your coronary arteries have some degree of plaque buildup. This is normal aging, but it's real. 90% of people over 60 have some atherosclerotic plaque in their coronary arteries. Most of it doesn't cause significant obstruction yet, but it's there. And if you add medications that constrict vessels or increase demand, you're adding stress to vessels that already have limited capacity. Third, your endothelial function declines. The endothelium is the inner lining of your blood vessels, and it becomes less flexible with age. It produces less nitric oxide, which is crucial for blood vessel dilation. So your vessels can't regulate blood flow as effectively. Medications that interfere with endothelial function, like NSAIDs, have a bigger impact when you're older. Fourth, your baroreceptor sensitivity decreases. Baroreceptors are the sensors that detect changes in blood pressure and trigger compensatory responses. When you're younger, they respond quickly and effectively, but at 60, this system is slower. So medications that cause sudden blood pressure changes, like alpha blockers, are much more dangerous. Fifth, your kidneys are filtering more slowly. Kidney function decreases about 1% per year after age 30. This means medications take longer to clear from your system. They accumulate more, and their effects can be stronger and last longer. So here's what I want you to do. First, make a list of every medication you're taking. I mean every single one, including over-the-counter medications, supplements, herbal preparations, everything. Don't assume your doctors know about all your medications. They often don't. You'd be surprised how many of my patients are taking multiple medications that interact badly with each other. Second, schedule an appointment with a cardiologist. Not your primary care doctor, a cardiologist. Why? Because your primary care doctor might be great, but they have to manage your entire body. A cardiologist specializes in your heart. They understand cardiac risk in a way that a general practitioner often doesn't. And if you're over 60, you should have a baseline cardiac evaluation anyway. Third, bring that medication list and ask specifically about each medication. Ask, is this still necessary? Are there alternatives? What are the risks specific to me? Does my cardiac status change the recommendation? Most doctors will welcome these questions. They want you to be informed. Fourth, don't stop any medications on your own. That's crucial. If you're taking something your doctor prescribed, they had reasons. But the reasons might need to be revisited. That's different from just stopping it. Suddenly stopping certain medications can be dangerous. Work with your doctor to adjust or change medications safely. Fifth, understand your own cardiac risk factors. Do you have high blood pressure? Do you have high cholesterol? Do you have diabetes? Do you have a family history of heart disease? Do you smoke? These things matter. They increase the risk that certain medications become problematic for you. Sixth, make lifestyle choices that protect your heart. This is the most important thing I can tell you. Exercise regularly, and I don't mean a little walking. I mean actual cardiovascular exercise, 30 minutes a day most days of the week. Control your diet. Focus on whole foods. Limit sodium. Limit refined sugar. Manage stress. This is not optional. These things matter as much or more than medications. Seventh, understand that aging is not a disease. Some people over 60 have perfectly healthy hearts. Just because you're 60 doesn't automatically mean you're at high risk, but it does mean you need to be thoughtful about medications. It means you need to understand your individual risk profile, and it means you need regular monitoring. Let me tell you about a patient. Let's call him Robert. Robert is 63. He came to see me because he'd had chest pain and was worried about his heart. When I reviewed his medications, he was taking ibuprofen daily for back pain. He was taking an alpha blocker for blood pressure, and he was taking an older antihistamine at night for sleep. He was also drinking 2 large coffees every morning. When I did his stress test and cardiac catheterization, we found he had about 50% blockage in his left anterior descending artery. Not bad enough to need intervention, but not great. We immediately stopped the ibuprofen. We switched his blood pressure medication to something safer for his situation. We stopped the antihistamine and replaced it with a better option. We discussed his coffee intake. 4 months later, Robert came back for follow-up. His chest pain was gone. His blood pressure was actually better. He felt better. He had more energy. All we did was remove medications that were creating unnecessary risk. This is my point. Sometimes the solution is not more medications. Sometimes the solution is understanding which medications are actually harmful for your specific situation. Now, I want to be absolutely clear about something else. Medications are not the enemy. When used appropriately, medications save lives. My entire career has been built on recognizing when the heart needs help from medications and procedures. Beta blockers are phenomenal for many people with heart disease. ACE inhibitors are life-saving for people with certain cardiac conditions. Statins prevent heart attacks. I'm not anti-medication, but I am pro-thought. I'm pro-conversation. I'm pro-understanding your own body and your own risks. And I'm pro-evaluating medications regularly instead of just staying on them forever because that's what you've always done. The heart is the most important organ in your body. It beats roughly 100,000 times per day for your entire life. It's resilient and it's strong, but it's also vulnerable. And when you're over 60, you need to be extra thoughtful about anything you put in your body that affects its function. So my final message is this. If you're over 60 and you're taking any of these 5 categories of medications, don't panic, but do something. Talk to your cardiologist, get evaluated, understand your risk, make informed decisions. Your heart depends on it. Medical disclaimer. This video is for educational purposes only and should not be considered medical advice. Always consult with your healthcare provider before making any changes to your medication regimen. If you experience chest pain, shortness of breath, or other cardiac symptoms, seek immediate medical attention. Thank you for watching. If you found this information helpful, please consider subscribing to the channel so you don't miss future videos about heart health and cardiovascular disease prevention. And if you have questions or topics you'd like me to cover, please leave a comment below. I read every comment, and your questions help me create better content. Thank you.